Okay, so we're here with Linda, and we're just going to be talking about some of the progress that we've had in the last couple months with some of the treatments that we've been doing. So, just first question, Linda, is what was the main thing that you came to our office for?
Chronic fatigue, and as it relates to fibromyalgia.
Okay, and is this something you've had for just a short period of time, or something you've been dealing with for a long time?
No, I've been dealing with it for a long time. I've had fibromyalgia symptoms since I was 4 years old. The chronic fatigue started I would say in the mid-70s, really bad, and it just has gotten worse to the point where I've been on disability now for a few months.
Okay, and like one of the main things that happens to you is you actually will overexert yourself, and then basically kind of just describe that process.
Well, it doesn't take much, and what happens is then for days or even weeks afterwards, I'll just be dragging around, and I'll be sleeping, and if I can, and just resting all the time, and in pain, and just kind of out of it mentally.
Okay, and then so for about 2 months, 2.5 months, we've been working on this. What's the best change that you've, what are some of the changes that you've noticed?
My sleep is a lot better, and so I feel more rested when I wake up in the morning. I'm having more good days and fewer bad days, and the good days are a lot better than the so-called good days used to be, and the bad days aren't nearly as bad and don't last as long. It's like now, instead of being in bed for a week or even 2 weeks, just maybe 1 or 2 naps during that one day will do it, and then just kind of maybe take it easy the next day, and then I'm good to go again.
Awesome. Basically, how did you come across our office, and how did you come to be a patient here?
A nutritionist that I was seeing had suggested that my HPA axis was not functioning properly, and that stands for hypothalamic pituitary adrenal axis. And so I Googled that with fibromyalgia, and Dr. Boydston's website came up as one of the first choices. And so then I read about it, and it just sounded like it was exactly what the nutritionist was saying that I needed.
Perfect. Before you came in, did you have any issues with coming in, any hang-ups? Were you skeptical that we could help you?
Well, I tend to be optimistic, probably,
okay.
And so I was just hoping that this would be it. And but of course, always after all these years of trying so many different things, of course, you're always going to be skeptical about something that sounds really good, and then and then you find out it didn't, or maybe it just helped a little bit, but then you reached a plateau and you didn't get any better.
So your recommendation, what would you recommend if somebody asked you about our office?
Definitely come here first. Don't waste your money on anything else. Do this first. And you may not need anything else. In fact, you probably won't.